Welcome to Chapter 10, the Male Reproductive System. In this chapter, you're going to learn to identify the functions of the male reproductive system, define terms related to the male reproductive system, define the word parts related to the male reproductive system, understand common medical terminology and abbreviations used in the male reproductive system. So first you need to understand the anatomy and physiology of this system. So the functions of the male reproductive system are to produce testosterone, to produce and store spermatozoa, and to produce, transport, and release semen. The organs and structures involved in this system include the prostate gland, the bulbourethral glands, the seminal vesicles, the testes, the epididymis, the vas deferens, the scrotum, and the penis. Additional glands that we're going to talk about in depth, terms, the bulbourethral glands secrete components of semen. The prostate gland secretes components of semen. The seminal vesicles produce seminal fluid, which is a component of semen, and the testes produce spermatozoa and testosterone. Additional production by glands are the semen, and that's the viscous fluid containing sperm and secretions of the male reproductive glands. Sperm or spermatozoon is the male reproductive cell produced by the testes, and it can fertilize an ovum in a female to produce offspring. Testosterone is the male hormone produced by the testes. Ducts and tubules in this system are the seminiferous tubules. Those are the coiled tubules in the testes where spermatozoa are formed. The epididymis, which transports and stores mature spermatozoa, and the vas deferens, which are the ducts that carry the spermatozoa from the epididymis to the urethra. So be sure you understand the anatomy and physiology and their terms. So here we can see the prostate gland, the vas deferens, the penis, the glans penis, the prepuce or the foreskin, the epididymis, the testicles, the seminiferous tubules, the scrotum, the ureter, the urinary bladder, the rectum, the seminal vesicles, and the bulbourethral gland. Additionally, the penis and scrotum. The penis is used in urination and sexual intercourse. The glans penis is the bulbous tip of the penis, and the prepuce is the skin covering the glans penis, and the scrotum encloses the testes and the epididymis. When we talk about word parts, andro for male, belano for glans penis, epididymo for epididymis, orcho, orchio, or orchido for testes or testicle, testo or testiculo for testes or testicle. Combining forms continued are the prostato for prostate, spermo or spermato for sperm or spermatozoon, the vaso for vas deferens, and the vesiculo for seminal vesicle. Prefixes and, without or not, and crypt for hidden. Suffixes, cell for herniation or protrusion, genesis for originating or producing, ism for condition of, lith for stone or calculus, and lysis for the destruction, breakdown, or separation. Suffixes continued, pathy for disease, pexy for surgical fixation, plasty for surgical repair or reconstruction, rhea for flow or discharge, stomy for surgical opening, tomy for incision. Adjectives and other related terms, balanic for pertaining to the glans penis, coitus for sexual intercourse, Condom is the sheath worn during intercourse to prevent conception or infection. Ejaculation is the expulsion of semen from the male urethra. Epididymal is pertaining to the epididymis. Prostatic, for pertaining to the prostate. Puberty, the period of development when secondary sex characteristics develop and the ability to reproduce begins. Spermatic, for pertaining to sperm. Testicular, for pertaining to a testicle. Terms relating to the epididymis, prostate gland, and testes, these are common symptoms and medical conditions. So BPH is benign prostatic hyperplasia, and that or benign prostatic hypertrophy, and that's the enlargement of the prostate gland. Epididymitis is the inflammation of the epididymis. Oligospermia is a scanty production of sperm. Orchitis is the inflammation of the testes or testicle. Prostatitis is the inflammation of the prostate. Prostatolith is a stone or calculus in the prostate. And here is a picture of benign prostate hyperplasia. You can see the prostate gland and the narrowing of the urethra, then the normal urethra, and the benign prostate hyperplasia or hypertrophied tissue. Additional terms relating to the penis and the scrotum. Erectile dysfunction is the inability of a male to attain or maintain an erection. A hydrocele is the accumulation of fluid in the scrotum. Orchitis is the inflammation of a testes or testicle. Peyronie disease is an abnormal scar tissue inside the penis causing bending of an erect penis. Phimosis is the narrowing of the prepuce. Priapism is the abnormal persistent erection of the penis. A spermatocele is a cyst in the epididymis containing sperm. Testicular torsion is the twisting of the spermatic cord causing a decrease in blood flow to the penis. And a varicocele is the enlargement in the veins in the spermatic cord. Here's phimosis. You can see the tight foreskin of the penis and the urethra. STDs or STIs, more often they're referred to, but sexually transmitted diseases is what STD stands for. That's a meaning like a venereal disease or a disease transmitted during sexual contact. Acquired immunodeficiency syndrome or AIDS is a disease of the immune system caused by the human immunodeficiency virus HIV. Chlamydia is a bacterial sexually transmitted disease. Condyloma is a wart-like lesion on the genitals. Genital herpes is the inflammatory sexually transmitted disease caused by the herpes simplex virus. Gonorrhea is the contagious inflammatory sexually transmitted disease affecting the mucous membranes of the genitals and urinary system. HIV, human immunodeficiency virus, is a virus that weakens the body's immune system and causes AIDS. The human papillomavirus, or HPV, is a viral sexually transmitted disease. It's really an infection that causes genital warts and other symptoms. Syphilis is the bacterial sexually transmitted disease that causes sores called cankers. And here's a picture of genital warts caused by the human papillomavirus. Here is a syphilitic canker. So what are some common tests and procedures for this system? Digital rectal exam, or a DRE, is the assessment to determine the size and shape of the prostate through the rectal wall. A transrectal ultrasound, or a TRUS, is the ultrasound of the prostate done through the rectum. Prostate-specific antigen test, or PSA, is the test that measures the amount of prostate-specific antigen in the blood, and it screens for benign prostatic hyperplasia and prostate cancer. Here is a visual picture of a digital rectal exam, and they're checking the prostate gland to see if that it's enlarged. Common surgical procedures is balanoplasty, that's the surgical repair of the gland's penis. Circumcision is an excision of the prepuce from the penis. Penile implant is the surgical procedure placing a penile prosthesis for patients with erectile dysfunction. Here is a visual diagram of a penile circumcision. Prostatectomy is an excision of the prostate gland. A prostatolithotomy is an incision to remove a stone from the prostate. TUIP is a transurethral incision of the prostate. It's a surgical procedure that widens the urethra by making small incisions in the bladder and the prostate gland. A TURP is a transurethral resection of the prostate, and that's the removal of prostatic tissue from the urethra using a resectoscope. And here's a picture of a TURP. That's the common procedure you're going to see. And there you see the bladder, the prostate, the resectoscope, the scrotum, the enlarged prostate being cut, and the site for the incision into the prostate. Surgeries and procedures related to the testes are an orchidectomy, an orchiectomy is an excision of the testes, an orchidopexy or an orchiopexy is a surgical fixation of a testes, an orchidotomy or orchiotomy is an incision into a testes, and an orchioplasty is a surgical repair or reconstruction of a testes. A vasectomy is an excision of a segment of the vas deferens to cause male sterility, and a vasovasostomy is a creation of a new opening using an incision between two pieces of the vas deferens to reverse the effects of a vasectomy. In a vasectomy, the piece of the vas deferens is cut and removed. You can see that in this diagram. Medications and drug therapies and antiretroviral medication is primarily used to treat HIV. Antiviral medications are used to treat viral infections such as some STDs or STIs. Impotence agent is used to treat erectile dysfunction, and a vasodilator is used to treat benign prostatic hypertrophy and erectile dysfunction by opening blood vessels. Common abbreviations in this system you're going to see is AIDS, acute immunodeficiency syndrome, BPH, or benign prostatic hyperplasia, benign prostatic hypertrophy, a diarrhea, digital rectal exam, ED, erectile dysfunction, HIV, human immunodeficiency virus, HPV, human papillomavirus. A PSA is a prostate-specific antigen, STDs, sexually transmitted disease, and more often now it's STIs, sexually transmitted infections. A TRUS, a transrectal ultrasound. A TUIP, a transurethral incision of the prostate. A TURP, which is the transurethral resection of the prostate, and VD for venereal disease. And that's it for the male reproductive system. We'll move on next to the female reproductive system.